Assalamu alaikum students. Today we are going to discuss team approach to nutritional care, follow-up assessment, limitation of a nutritional assessment, patient responses, patient behavior, or patient right. Team approach to nutritional care, the coordination of various hospital departments to meet the patient nutritional need. In nutritionally, doctors are responsible for ordering nutrition support, writing diet orders. Dietitian must consult with physician in order to start or modify patient nutritional order. In healthcare setting, to provide the best treatment to patient or care of best care of the patient, individuals from the different departments work with each other, in which nurses, physicians, pharmacists, and dietitians. And dietitians are the important part of this team that coordinate and with physicians, pharmacists, nurses, speech pathologists, occupational therapists, social workers to provide when providing nutritional treatments. In team approach to nutritional care, nurses are the pillar of clinical settings and play important role because they provided care of 24 hours a day, and commonly nurses are responsible for documenting a patient food intake and notifying the dietitian if the patient has low intake or any other issue related to nutrition. Pharmacists, occupational therapists, and speech therapists are also part of this team. Pharmacists are responsible for compounding nutrition support formulas and when in case of NG feeding, and occupational therapists when patients have any mental, physically, emotionally disabling. So these occupational therapists help to improve their ability to perform daily tasks and improve their health status. And the main uh, part of the occupational therapist are to provide the instruction on eating and using the adapting feeding devices. Speech language pathologist or speech pathologist therapists. They work with dietitians, nurses, physicians to provide nutrition support where individuals with eating disorder in which they are difficulty to eat. Team approach to nutritional care for basically five main points. And the first point is communication with physician, dietitian, all the department. First, the prescription or the diet order that is provided by doctors, and then the providing the dietitian, physician information regarding the patient response to diet. So first is a communication between physicians and dietitian. Basically, the responsibility of the dietitian is providing the therapeutic nutrition or the type of diet recommended by a dietitian according to patient needs, and monitor the response of patient to diet. Assisting the patient at mealtime, the environment of the hospital, disturbances, or the sounds of machines, they are all factors that increases the stress or anxiety of a patient. So providing the pleasant environment, preparing the patient for the meal, or helping the handicap to adjust the self-feeding, and giving encouragement and support to the patient. interpreting the diet to the patient, so explain the reason to modify or change the diet, and recording, observing the response towards the diet, whether intake or like, dislike, attitude, or health conditions related to diet. And for the last point in planning health, approach to nutritional need, team approach to nutritional need is providing the nutritional support for home, or arranging the counseling, recording the home diet with the family members. In diet therapy or in therapeutic nutrition, there are various factors that should be considered, in which severity of disease, rationale for diet changes, drug therapy, and patient responses. In severity of disease and type of diet, patient requirement according to their disease, the diet requirements are changed in diet. Rationale for dietary changes in beneficial or the possible adverse effect of diet. Nutritional limitation of various modified diet when patient with various disease or religious culture factor. These are other factors that affect on diet. And drug therapy, their in food drug interaction or food intake, that affect on the food intake, utilization, absorption, patient tolerance rate, or patient response, the patient response toward the diet, including their behavior, food intake, their body or health response to diet. Patient's care. When dietitians are planning or modify their diet, they must be consider the appealing texture, taste, psychological, emotional factors that influencing the food acceptance or food intake. And some patients may require modified diet for weeks or months or even lifetime. And it varies from case to case or severity of disease, patient response toward disease and health. For example, in case of celiac disease, some patients require modified diet for lifetime, and or some patients require for 2 to 3 years. Other environmental factors like social, culture, or economical factor, availability of food, cost of food, these are or preparation. These are other factors that maybe affect the food intake. Interpersonal relationship with patient, the needs of patient. Um, Patient has physical, psychological, social, spiritual needs. So each person wants to be treated as an individual, has specific needs and values that are unique for him, and they want they treated as individuals, and more care, listening, care for patient must, or the caretaker or the nurses must be listened carefully, or uh, listen their complaint, mostly complain about change of in related to nutrition, or why our diet are modified. And casual conversation with patients may bring to light that their past diet are not healthy or not according to their disease. For example, in case of older people, lack of teeth or poor health, inability to prepare food. So due to all these reasons, we modify uh, diet. Patient's right, patient or person has a right to expect from the health team, explain the reason of the modification. So to explain the reason of the modification, why we change the diet or modify the diet, explain with the reason. um, for example, in case of the diabetes, to explain that for to prevent the further complication we modify your diet, or if a person is hypertensive, to reduce the intake of sodium, or the balance sodium potassium intake to prevent the further diseases, or further complications. If dietary counseling start earlier, it helps in patient to learn what changes will be needed in the diet, and when the patient goes home, if the patient who has physically handicapped should be helped to feed himself, and the patient behavior towards the modification of the diet, or to understand the importance of modification of diet, and to improve their health status or quality of life. So the different patient has different responses toward modification of the diet. Some has positive responses and negative. But in patient or relationship with patient, when we are modify the diet, the patient counseling is one of the important part to justify, to satisfy the patient. Recognition of attitude. Nurses or dietitian what feel about the patient, or who does not eat the food, or who eat too much, or complain about a dietary restriction or any treatment that is provided to patient. It is a responsibility of the dietitian nurse to understand, or any other physician health worker to understand that patient are complain about treatment or complication or modification of the diet or restriction of the food. They are not against any individual, or not against any dietitian nurses. So it is a responsibility of the all the health worker to show the positive response or the positive attitude when they are dealing with patients, not show any negative impression, or not treated the patient or as a when we provided the nutritional care or modified the diet, then we do the follow-up assessment to identify whether we continue with the modified diet, or change the dietary needs, or response of diet toward their health or disease. So follow-up assessment indicate, or in follow-up assessment we do both weight measurement, lymphocyte count, albumin, transferrin, or keratin, creatinine, uh, height index, cell-mediated immunity. In follow-up assessment, for example, in case of NG feeding or tube feeding, verify that tube feeding is being provided at desired rate, or for the nutrient that are being provided, compare the nutrition provided to estimate the need and make the changes, recommendations. In general follow-up assessment, for example, there are various or a different duration of the follow-up according to disease. In case of constipation, diarrhea, 3 days follow-up. In case of fatty liver, for 1 month follow-up. In uric acid or diabetes, 3 month follow-up. In case of lipid or cholesterol, 2 week follow-up, and in weight management also 2 week follow-up. Limitation of the nutritional assessment, accuracy of the test, or some the sign and symptoms. Sometimes it not show earlier. For example, in case of the osteoporosis, the symptoms or the signs are show after 40, after 45. One of the limitation in nutritional assessment, or sometime the confusion in signs or symptoms, whether it may be related to any disease or nutritional deficiency, for example fatigue, diarrhea or skin conditions. It may be due to any disease or any treatment, or due to poor intake. So sometimes there are confusion about any sign and symptoms, or the appear or onset of any sign and symptom, or accuracy of the test.